So thank you for joining us. This is the second DHMOSH Public Health Leadership Seminar Series talk. And today we will be having Dr. Stephen Thomas share with us essential leadership skills for public health practitioners. And I'm Dr. Esther Tan. I'm in charge of the public health section of DHMOSH. DHMOSH stands for Division of Healthcare Management and Occupational Safety and Health here in the UN headquarters in New York. So I just wanted to give you a little bit of an introduction about what this whole series is about. So this public health leadership series is targeted at UN staff who work in healthcare and the public health field, and it has threefold purpose. So first is to empower you with foundational tools to improve public health practice in your duty station. Secondly, to prepare you to respond to a range of public health emergencies and crises. And thirdly, to build effective leadership and management skills in the UN public health and medical community. So today's talk will really be trying to fulfill the last objective. If you have not yet checked out our website to look at the different public health programs that we have, we will put a link on the chat. And if you're interested to be on the mailing list for future webinars of this series, we'll also put a link on the chat so that you can sign up. So before I start, I just wanted to introduce to you Dr. Stephen Thomas. He was with us last month talking about infectious disease in the military, but we're so happy to have him back with us again. And he is professor of medicine, professor of microbiology and immunology, and an infectious disease physician scientist from SUNY Upstate Medical University. He is also director of the Institute of Global Health and Translational Science and the interim chair, microbiology and immunology. So before joining Upstate, Dr. Thomas actually spent 20 years in the US Army, serving at the Walter Reed Army Institute of Research, and completed his career there as the Institute's Deputy Commander for Operations. Dr. Thomas specializes in the study of viruses and vaccine development and spent more than 5 years in his early career living and working in Thailand. He has played key leadership roles in the US government's response to the Ebola outbreak in West Africa, to MERS-CoV and Zika epidemics, and was instrumental in the development and advancement of vaccines for each of them. Currently, he's also the global coordinating principal investigator for Pfizer's phase 2 or 3 COVID vaccine trial. Dr. Thomas has his Bachelor of Arts with honors in biomedical ethics from Brown University and his medical degree from Albany Medical College, and completed internal medicine residency and infectious disease fellowship at the Walter Reed Army Medical Center. So without further ado, I'd love to hand over to you, Dr. Thomas, to tell us more about what you think are the essential leadership skills that we should have as medical and public health practitioners. So over to you, Dr. Thomas. Thank you.
Hi, good morning. I just want to come on camera, say hi to everybody. I'm probably going to go back off of camera though, because I think it hurts with some of my my bandwidth here. So good morning, good afternoon, and good evening. Yes, I want to talk about some of the leadership skills, and it's designed for public health practitioners or anybody who kind of works in public health, and it's really more of a general kind of discussion. I think it's important when you talk about leadership and when you talk about leaders to kind of understand the perspective that they're coming from, because obviously, you pick up information and you pick up skills and education and training through the pathway that you take in your life. And so for me, as was already mentioned, I was in the Army for 20 years, from 96 to 2016, and I had a real diverse range of assignments, all of which really helped to build my perspective and my thoughts and philosophies about leadership. Obviously, I'm a clinician, and so I started with training from being, an intern through a resident and then ultimately a fellow. And in the military, infectious diseases physicians kind of go into two different realms. They go into either clinical medicine or they go into research and development. And so here in the upper right, that's the Walter Reed Army Institute of Research, which is in Maryland, but they have field sites all over the world. And so the field site that I went to as a virus researcher was a place called AFRAMS, and it's a collaboration with the Royal Thai Army. And I spent almost 6 years there doing lots of field work, work in hospitals, work out in the field, kind of setting up surveillance projects, and whether it was for respiratory diseases or vector-borne diseases, working with local ministries of health and people who ran hospitals and people who ran clinics. In 2013, 2014, I had a couple of months that I spent in Jordan, in Amman, working with the Royal Medical Services in Jordan, and there was a lot going on at that time, of course, in the Middle East and Syria specifically, and there was a lot of public health problems and a real huge refugee problem, and so I picked up a lot of ideas and thoughts and experiences working with Jordan's Royal Medical Services and that issue. And then when I came back and was the deputy commander for operations, which is basically it's kind of like a chief operating officer position. That is when we started having the issues with Ebola in West Africa. We had MERS-CoV, and then we had Zika. And so I was able to be one of the U.S. Department of Defense's representatives to the whole of U.S. government response to those outbreaks, which included President Obama sending 3,000 U.S. service members to Liberia as part of Operation United Assistance. So that was kind of my early career and perspective. And then most recently, so I guess the past 5 years or so, I became an academic, and so I participate in three main activities, which is clinical care, so taking care of patients, educating the next generation of medical professional, which is not just physicians, but it's nurses and technicians and masters in public health students, et cetera. And then research and development. And of course, the big thing for all of us over the last 2 years has been the COVID pandemic. And because of my leadership experience, my experience in the military, and being an infectious disease guy, I was able to be what they call the commander of the incident command, which, we have about 11,000 employees. We're the largest medical provider in central New York, which is about 10%. We take care of about 10% of New York's population, so we're just over 2 million people. And so we had a lot of responsibility, and incident command is activated when there's a big, major kind of cross-cutting issue. And so I was able to command that group as we prepared for the wave of cases that were going to come to central New York. And so I was able to do that. And as you've heard, I've been able to play a role with Pfizer and BioNTech and the vaccine development community. So those are the sort of experiences that have shaped my philosophies. And as Dr. Tan had mentioned, I'm a physician scientist. So on the physician side, I care for people. I try to promote wellness. And if people are ill, I try to help with diagnosis and treatment. But it's also, I believe, a clinician's job to be observant and to always understand what's going around them. And that's how this entire pandemic started. You may remember there was there's something called ProMed, which is basically a kind of a string of, it's kind of like a chat room almost, if you will, for infectious diseases. And it's where people can put up requests for information, or they can report trends that they're seeing and ask for help. And I remember, it was at the end of December 2019 when clinicians from China had reported that they were seeing pneumonias and severe pneumonias and a cluster of pneumonias that they could not make a microbiologic diagnosis. And that was kind of the shot that heard around the world, if you will, that there was something going on, and we've all been living the story ever since then. And then the other side of what I do, though, is as a scientist, right? And that's basically, as I look at it, kind of asking and trying to answer questions. So we make observations, we try to develop hypotheses to explain those observations, and then we design and conduct experiments to generate facts, which will either prove or disprove or cause us to modify those hypotheses. And so I kind of look at, and so again, this shapes the perspective that I'm coming to you from today. So this is Sir Ernest Shackleton, and so I think when we have all of us have examples of leaders that we like to emulate, would like to emulate, or who we have found that they did some amazing things, and he's one of the leaders that I look to. So he was an explorer, and back in the early 1900s, around 1914, he took this crew of men down to Antarctica, right down to the South Pole, and was going to be one of the first. He wanted to be the first group to kind of trek across the pole and on foot. And unfortunately, what happened was through some misjudgments and miscalculations, which good leaders make all the time, they got caught into the ice, and their ship, called the Endurance, got caught in the ice pack and was crushed. But the point is that it took them almost 2 years to get back to safety. And in the end, it took this very small group here, which this is an actual photo. It took a very small group in a very small boat in some of the most treacherous seas on the planet, going hundreds and hundreds of miles to find help. And in the end, even after almost 2 years, basically living on ice, every single one of his men made it back, and made it back safely. And I would encourage people to kind of look at how he was able to do this. And a lot of the concepts that I'm going to talk about with you this morning were embodied by his journey and by their journey. And I just like one of his quotes here because I think it applies to all of us, that if you're a leader, people are going to look to you. And they're going to look to you for decisions, and they're going to look to you for what kind of, what behaviors to emulate. And one of those behaviors is that you have got to keep going. And there's a book that was written called Endurance, and I would encourage all of you to get a copy if you can. It's a short read. And it's just an incredible story. So one of the first things is, as I think, is that you need to be organized as a leader. And so you need to, whatever the situation is, big or small, you need to unite people by mission. We know when we look at sort of the business literature and literature from corporations and groups that have that talk about the leadership of business and people. It's, people do their jobs, and they do them well, not necessarily because of the money and not necessarily because of the benefits. They do it because they are united by something that is bigger than themselves. But it really is up to the leader to very clearly articulate what that bigger thing is. And it is up to the leader to show people and to tell people how they are all connected in trying to meet this mission. And all of you are part of a very important and global mission, but you, of course, have your own individual missions within that larger UN mission. But organizing people by mission, I think, is very important. And then you kind of organize folks by function. So this is just a screenshot of a Zoom call that we had during the incident command that I mentioned during the pandemic. This is a similar sort of situation that we have, in the military. And at any one time, we would have over 100 different people on these calls. I'm on the upper left, kind of at mission control. At any time, these 100 people, many of whom didn't know one another, even though they work in the same organization, and they didn't know what the other person did. So you really have to, I think it's important to have people organized by function, to have everyone understand who is doing what, to be very clear in development of your tasks for whatever it is, small problem, big problem. Make sure everyone has a common view. What I mean by that is, the big mission here is to prepare our community for a wave of COVID infections, for example. And it's going to involve logistics and clinicians, and it's going to involve people, administration, and it's involve human resources, et cetera, and understanding the tasks that each of them have, and making sure that people know, I am tied to human resources. What I want to do is going to require finance and HR to do their job so that I can do mine. And again, understanding that you're all kind of in the boat together, and you have to row in the same direction if you're going to achieve that mission. And then I think it's important to formalize feedback. And so there are some things that go well, and there's some things that don't go well. I think we have a little bit of a, at least in my country, there's a little bit of a culture where folks don't always necessarily want to discuss or highlight some of the challenges that they've had, or some of the problems that they've had, or to assign particular challenges to a particular person or group. But I think that you need to do that. Otherwise, you miss an opportunity for lessons learned. So be organized. That's one of the things that I think is very important as a leader. The next is to be cross-functional. So many of us, we live in our lane. We live in our, we have a very myopic kind of tunnel view of, this is who I am, this is what I do, these are my left and right limits, and I just stay within this lane. And I have found that the really, really big problems and the really important problems, they don't get solved when you have teams that are organized into stovepipes, right, is what we would call them. So big problems really need team solutions. You could call it, team of teams, or cross-functional teams. If you're an isolationist and you are not able to, or unwilling to kind of understand what the person to your left and right are doing and what their role is in the bigger picture, I think that you're going to have limited value to the team. It sounds like a very simple concept that people should have dialogue and communicate, but it is probably one of the biggest challenges that any organization has, even in a small team, is encouraging people and ensuring that people are talking to one another, and again, giving them that common view, right? So again, upper left, we had over 100 people on these calls, and I guarantee you 60-70% of them had never met one another, and they had no idea what that person did for the organization. And so you really need to encourage and force dialogue. And then you have to, again, demonstrate connectedness. So, I like this picture of the people here climbing the mountain, because what you can't see is that they're all tethered together, right? There's a rope for everybody's safety that's tying everybody together. Because if one person falls, the others are expected to ensure that that person doesn't fall all the way down the mountain. Another analogy would be that you're kind of all in the same boat together, and you all have an oar. And we've all been in organizations where some people in the boat, they won't row. We've been in the organization where some people in the boat will rock the boat, or some people in the boat will stand up, turn around, and start rowing in the other direction. But it really is, I think, on the leader to show and to demonstrate in a very tangible way that, Bob, you are connected to Sue. Sue, you are connected to Jim. And if each of you does not do your part to this big problem, whether it's big or small, you're not going to achieve success. And then, through, I think, my experience has been that through demonstration of this connectedness, and by ensuring that people are talking to one another, that's how you develop trust. And when you develop trust and you have trust within a team, then you feel okay about taking risk together. And this is just an article from the Harvard Business Review called "Getting Your Stars to Collaborate," and it's about the Sloan Kettering experience, basically, of going from a collection of individuals thinking individual thoughts to a cross-functional team that has now become a huge and very important source for clinical care, source for education, and source for research. And they mention in there, one of the quotes I love is, smart collaboration is not just a nice to have, it's a strategic response to external change. So then the third thing is, and I think this is really important, is understanding your limits. And I kind of look at three things. Anytime that I'm being either told that I'm going to have a leadership position or I'm being offered a leadership position, I look at the position and I look at three things. What are my responsibilities? What are my authorities? And what are the resources that I'm being provided to do that? Because if there is a disconnect in any of those elements, then I'm really going to look long and hard at whether or not that is a good opportunity for me, or whether or not we are going to be set up for success. So, for example, if you have the responsibility to ensure, okay, so just for example, wearing of PPE. So we're going to do universal masking in our hospital to prevent COVID infections. So everyone has to wear a mask all the time. So, my responsibility is to come up with a plan to prevent infections. So that's my responsibility. My plan is to do universal masking. But who has the authority to actually make people wear their masks? And if I don't have that authority, or I don't have the support of someone who has that authority, my plan is not going to work, because not everybody wants to wear a mask. And if I don't have the resources to communicate and get the word out, or to ensure that there are enough masks in the facility, it's not going to work. So responsibility without authority puts you in a very weak position. Responsibility and authority without resources is going to be very difficult to operationalize any kind of plans that you want to think about. And, so this is my university. So my job and my colleagues' job was to come up with policy and guidance that hopefully would lead to positive actions to protect people from COVID, for example, or allow us to take care of COVID patients. But I can't make up policy without understanding what my county health department's policies are. And they can't make policies without understanding what the New York State Department of Health policies are. And those policies, even though at the state level, it's where they get that's where the authority is, they're going to follow what the federal advisors or federal guidance is from our CDC. So I think understanding your limits is really important. The other thing is, and it's part of understanding your limits, is you need to understand whether you are just communicating the decisions of someone else, or if you are actually making them, because I think those are two different contexts and two different perspectives that you really need to understand, primarily so you can make sure that you're going after the right target for yourself as the leader, but also just to, again, to be able to make your strategy, right? Because it's two different strategies, whether you're making decisions or just communicating. And then the other thing is, in terms of understanding your limits, this seems like it's conflicting, but I say be aggressive, but also be patient at the same time. And to me, that means, we all want to attack our mission and very aggressively, and we want to dive in and we want to give 110%. But at the same time, when you have processes like on the right here of information being communicated down a funnel that ultimately ends up to you, you also have to kind of demonstrate maturity and patience at the same time. So that's number 3. Number 4, clearly communicate. Again, this is probably one of the most important, in my opinion, one of the most important characteristics or traits that a leader has to have. So clearly communicate the first time, especially in this day and age where you have 24-hour news, you have constant constant social media threads that are going up every single second with new information. You really, as a leader, have a lot of pressure on you to clearly communicate at the very first opportunity. There's all sorts of discussions about, well, what's communication? To me, it's kind of very simple. It's, information was provided, information was received, and that information was understood. So a lot of people think that communication is just the first. I wrote you an email. I communicated to you. I wrote you an email. How come it didn't happen? Well, that your job as a leader does not end with you just sending information out, or I told you what I wanted you to do, or didn't you get the memo? some people stop at the, well, you got my email, you said you read my email, how come it didn't happen? It really has to include all three components. And I think it's incumbent upon a leader to ensure that the information, not only that you sent out was received, was actually understood. And this is really important, I think, when you're dealing with issues or missions where there's a very high operational tempo, because if you do not have clear lines of communication, if those lines of communication are not robust, if people are not reliant on them and using them, you're not going to be able to withstand the frequent changes that might occur. And again, COVID's just a classic example. And you know, the media in my country spends a lot of time kind of going back and calling out errors that certain officials made at certain times within our pandemic, based upon the messages that were put out at the time. And they really don't have any allowance for the fact that facts change and information changes, et cetera. So you really have to have a very good lines of communication, and those systems of communication have to be resilient to withstand the high operational tempo and changes. I think we have some. Can I ask for people to mute, please?
لا والله أنا والله شغال عندي لقاء على الزوم.
Thank you. And then, because as we all know, poor communication leads to, in the best case scenario, you'll just be inefficient and you'll lose opportunities. But often what happens is you end up making really bad, you end up making bad decisions. And, you know, Sun Tzu, a good quote, you know, if the words of command are not clear and distinct, and if the orders are not thoroughly understood, it's the general leader, right? It's the leader to blame. So clearly communicate. And then I think communicate with intent, because it's not just the reason you want to clearly communicate is because you want someone to do something, right? You want an action. So first, know your goal, right? So I do lots of media because my goal is to try and put into the public domain accurate and factual information so that people will exhibit behaviors or execute behaviors that will protect them and protect others. You really have to understand your audience. You got to understand what their context is and what their perspective is. So we know from lots and lots of different studies and experiences that people are more likely to accept a message, and they are more likely to exhibit behaviors if the person who's delivering, if they can relate to and they can identify with the person who is delivering that message. And that goes against race and ethnicity and socioeconomic status and culture and everything else. So you really have to know your audience, understand their context, understand their perspective. And if you are in a position where you have to communicate across a diverse range of people, then it has to be a very accessible message for everybody. It cannot just be speaking to one group or another. So know your audience. The third is be disciplined. So this is on the right is Ryan McMahon. He's my county executive. This is Ben Walsh. He's the mayor. And they were communicating to this region, the city in Mr. Walsh's case, Mayor Walsh's case, and the county in Mr. McMahon's case. They were communicating daily, and at the height of the epidemic here in central New York, and they were good, because sometimes their answers were, I don't know, and I can just say it is very difficult, again, because we live in a society with so much information and so many people who have the ability to communicate to broad audiences. There is very little tolerance for people when they put out misinformation, and people will stop listening to you. So I think you need to be disciplined, and you need to know when you're communicating something that either you're not sure about, or that is outside of your wheelhouse, your expertise. And then obviously listen and learn. So there's lots of different phrases. I've always learned more from listening than I have from talking. I like the Dalai Lama, what he says, when you talk, you are only repeating what you already know. But if you listen, you may learn something new. And so communication is not just delivering information, but receiving it. Making decisions. So, leaders are expected to make decisions. That's what they do. So leaders make decisions and managers execute those decisions. Obviously, managers have to make decisions as well at their level, but leaders are the ones that are typically called upon to make decisions. There's no such thing as all the facts. So sometimes you'll hear leaders say, well, I don't want to communicate any information yet because I don't have all the facts. If you do have all the facts, and that's when you are communicating, you're too late. You have already missed the optimal window to provide information and to impact people's behavior. Colin Powell, who is a very high-ranking general in our military and then Secretary of State, he has different rules that he talks about, but he thinks that by when you have about 40% of what you think the knowable information is, that's really when you need to start developing your message, and you really need to have delivered at least your first message by the time you have about 70% of the information. So there really is no such thing as all the facts. You're going to have to make decisions with partial facts, and timing is everything. So again, this looks like it's in conflict. That you don't want to rush to a decision, but you also don't want to delay a decision. And so you're just going to have to get comfortable with the fact that you're going to make decisions with the best information that you have at the time, manage people's expectations about what your fund of knowledge is that you're making the decision on. And unfortunately, as a leader, you need to be able to prepare to stand alone. Now, fortunately, most of the time you're going to have teams, with you who agree with you, and people who agree with you, and people who will stand behind you. But we know, especially for some of the more controversial decisions that you might have to make as a leader, or decisions where there are going to be people who perceive themselves as having won, and people who perceive themselves as having lost. You need to be prepared as the leader to stand alone and stand by your decision, and to feel comfortable that even if everybody who you think supports you was to flee, that you would still say, I made the right decision, and I stand by this decision. So one of our presidents, Teddy Roosevelt, who was a very plain speaker, I thought that he had a good quote. In any moment of decision, the best thing you can do is the right thing. The next best thing is the wrong thing, but the worst thing you can do is do nothing. And I think that is very true. The worst leaders and the most ineffective leaders are those leaders that make no decisions, not the ones that make bad decisions. So there's a concept called disciplined initiative, and I think that this is important because it reflects whether you have an effective leader or not. So what disciplined initiative is you are the leader, you have subordinates. You are going to give a plan or orders to your subordinates, and you're going to make that plan, and you're going to formulate those orders, and you're going to make those decisions, again, like we mentioned, probably when you have about 40 to 70% of the total information for any particular situation. What disciplined initiative is it allows your subordinates to modify the plan when the situation or the information changes. So when the situation that they find themselves in is different than the situation when the orders or the decisions were made, when it's different, then they can modify this plan. So this isn't really necessarily a leadership trait per se. I think that it is a positive effect of effective leadership, such that, because what disciplined initiative requires is It requires you to be an effective communicator. It requires you to make informed decisions, and it requires that your subordinates are in lockstep with you, with the mission, with the understanding of what their situation is. And of course, this has happened all the time with COVID. So PPE, you don't have enough PPE, or you don't have the right PPE. How are you going to modify your PPE based upon the situation that you're in, so that you can continue to do your mission and maximally protect people? How do we triage patients, right? So in the time of COVID, you're not going to be bringing every person with an influenza-like illness into a small triage room, right? So you have to come up with, no one's going to tell you in specific detail how to set up your triage unit. You're going to have to understand that, okay, my mission is to triage. The situation is that there's lots of COVID in my community. How am I going to reduce risk of people mixing together, and sick people, infected people infecting the uninfected? So that kind of a scenario. And you can see there's lots of other things: testing, rooming, treatment, communication, how you demonstrate compassion. So for example, the recommendation might be no visitors in the hospital, right? That might be the recommendation. There's so much COVID going around. We do not want visitors coming into the hospital, because we do not want them infecting our staff, and we do not want them walking through the hospital and potentially infecting other people. But at the same point, you have people who are going to die, right? And you want to be able to demonstrate compassion. So you modify the plan because the compassion is important. So how are you going to modify the plan? And I just have a picture here of, we had the resources to use iPads to allow sick patients to see their loved ones, to speak to their loved ones, and communicate with their loved ones without having to come into the hospital. So this is, again, disciplined initiative is an output of a good and effective leadership. And then taking calculated risks. So everything that we do, especially the missions that all of you do, there's risks, and some risks are small, some risks are great, some are associated with, there's a very high likelihood they're going to occur. Some are associated with, if they do occur, it's going to be really bad. Whereas other risks are, well, if it does occur, it's really not going to impact the mission that much. But to be able to calculate risk, you need to kind of understand your team, right? You need to understand their strengths. You need to understand their opportunities for improvement, or their weaknesses. You need to understand, I think, your team's comfort zone. And you need to understand it, in my opinion, not primarily to keep them in that comfort zone. You need to understand what their comfort zone is, so that you understand when you've crossed it, and for how much and for how long you can keep them outside of that comfort zone. Again, it gets back to communication, but you really need to get buy-in from your team about taking risk. So it really cannot be, I'm the leader and I'm telling you, you're going to take this risk because I'm telling you to take this risk. You have to secure everybody's buy-in to taking risk. And typically that comes back to, again, I am part of something that is bigger than myself. I am part of something that is more important than just me. And I am therefore willing to take this risk because this thing is important. And the person who's taking this risk with me is important. And we're doing it as a team. And so I'm going to be comfortable with doing that. And then, once you've kind of moved out and you're doing your mission and you've decided and you've assumed this risk, you really need to check in often, and you need to reassess how the team is doing, and you need to reassess the mood of the team, and to understand whether or not everything's going great, people are doing well, and I can step on the gas a little bit more and I can push my team a little bit more, or we're having problems with burnout, or people are getting very, very anxious, or people are getting agitated, and we need to kind of pump the brakes a little bit, regroup, reassess where everybody is, resecure buy-in to taking this risk together. And I just put two examples here from my own university. As was mentioned, my university is participating in the testing of the Pfizer vaccine. And although we had a lot of experience testing vaccines before, never at the scale and at the speed and in the midst of a very dangerous pandemic. And so I had to go through all of this process frequently, and I still am, to understand how much we could push our people, which includes, having sick people come into the clinic. They're at risk, you're at risk, your family's at risk. How do you feel about that? Working, 14-hour days, working at night, working on weekends. And then this is Dr. Frank Middleton. He invented a saliva-based test for COVID, and he had a team, and that team was used to developing tests, but not with the level of attention and scrutiny of the FDA and this New York State. And he ended up developing a very high throughput saliva-based test, which they've done millions of tests, and it's allowed the State University of New York education system, which has 64 campuses around the world and 1.3 million students, has allowed those campuses to stay open because we can do frequent testing. But again, it was about taking calculated risk. And then this is my last slide, is always remembering why you lead, right? Why do you put yourself in the position of needing to have all those traits, which I just mentioned? Because it's a lot of work. It's a lot of study. It's a lot of training. It's a lot of making of mistakes. It's a lot of not always being the popular person, sometimes failing in a very public way. It's, taking responsibility for things that impact other people's life. And, one of the quotes from, this is from Sir Francis Bacon, who you can see lived a long time ago. And he had many, many different roles, but he was part of the court, and he advised the highest levels of government in his day. And I think he addresses, even back then, 500 years ago, he addresses maybe one of the greatest challenges we have today, in that being able to be truthful with your boss, and being able to tell your boss when things are not going well, or being able to tell your boss that you have a different perspective, and sharing the unfortunate realities that exist sometime, because obviously there's no other way to, you need to deal in realities if you're going to be successful. And we have seen this, again, in my country in a very public way at the highest levels of government, where we have had leaders that did not want, they wanted to hear what they wanted to hear, regardless of what the reality was. And so, and I think this quote from, 550 years ago, it still rings true today, which is, remember well the great trust you have undertaken. You are a continual sentinel, always to stand upon your watch to give the king true intelligence. And if you flatter the king, you betray him. And I really feel strongly about that as a leader, that if you are not telling your leadership the truth, if you're flattering your leadership, you are actually betraying them, because you're not going to be successful in your mission. So those are just a couple of things that I kind of have picked up over time in some of my philosophies and leadership lessons. And I thank you very much for your attention, and I will hand it over back to Dr. Tam, please.
Thanks so much, Dr. Thomas. I think that was one of the best leadership presentation I've seen, and I've watched a lot. So thank you very much for sharing your wisdom with us, and just based on your vast experience, especially as well in the military, where obviously a lot of leadership skills are learned there as well. So thank you for sharing all that. if any of you have any questions, please feel free to just put them on the chat. But if not, let me maybe just ask Dr. Thomas a few questions. One is really about kind of communication blocks in an institution or organization. I mean, obviously communication is so important. We can't, do a lot of things without having transparent, open communication. But, within the UN, maybe because of, the fact that it's very multicultural, the fact that its mission is very broad and very comprehensive, some overlap and duplicates as well. So because of that, I do find that there tends to be a lot of silos and a lot of blockage, communication blockage, and a lack of transparency between people, between units, so what are some of your strategies around that? Have you been in an organization that has that, and how have you tried to overcome that?
Yeah, well, I think that one of the ways that people, I think that, and I think this is a mistake. I think that people try to exhibit command and control over a situation by trying to limit communication, by trying to limit who is in the room, right? Who's in the room, who can hear this, and it's a way to kind of, which again, I think is a mistake. People feel that that's how they can control a situation. Now, I agree, not everyone needs to be in the room for every conversation. But what I have always kind of thought about when I'm sort of like, well, who needs to be here, who doesn't, is just I just step back for a second and say, what is the desired outcome of this message, right? What do I really want to achieve with this message? And if I include these people, how's that going to impact? If I don't include them, how's that going to impact? So for example, there are occasions when I will want people to be very upfront and very real with me. And so I will organize meetings that I'm not present at, because I know they won't say things if I'm in the room. And so, I will have a trusted colleague who will run that, that meeting, and they'll come back to me and they'll say, you were right. If you were there, they would not have disclosed this information. So that sets me up for potentially having things being said behind my back, but I don't care, because the ultimate goal was to get it right? The ultimate goal was to understand the information. So that's just sort of, so to me, it's just think of the essence of what you're trying to communicate and why you're trying to communicate it.
Great. And then my other question relates to kind of the context that the UN operates in, again, because we're so multicultural. And, you mentioned that you have experience in Thailand, where obviously, again, communication differs in a certain type of cultural context. So what is your advice to us as managers who might be leading a multicultural team? And what are some of the challenges and opportunities there versus, leading one that's all the same nationality, for example?
Yeah, I learned a lot of lessons the hard way in that particular area, because we worked in Thailand, but our mission went to Laos, Vietnam, Myanmar. It was the entire Southeast and South Asia. I think it would be good if you can understand and learn and be a student of the cultural context that everyone else is coming from, to understand how people dispense and receive information. But I think what you have to do, and the UN is great for this, understand what all the commonalities are, right? So you build the foundation based upon what is common among everyone, which is, for this particular mission, you have the overarching mission of the UN, and then you have the overarching mission of the medical personnel and the people who support the medical mission of the UN. And then you have your very specific mission, and everyone is bound. So people are bound by together and joined and common in these multiple things. And so that's where I kind of, start, right? So, in my case, it would be So for example, if we're making a vaccine against COVID, well, you're a lab person and you're a logistics person and you're a lawyer and I'm a clinician, but we're all here to achieve the same thing, which is to develop something that is going to reduce human suffering and maintain the healthcare system. And I find if you start from that common point, everyone can always circle back to, well, I don't understand. Okay, I'm trying to make this thing to help people. Fine. And it always gives you the ground to come back to if you need to restart a conversation, if you need to kind of reset and reorient people. So that when I started doing that, regardless of what country I was in or who I was talking to, it always seemed to put people on at least the right footing to begin with, and it just facilitated discussions. That's been my experience.
And it sounds to me that, having that kind of clarity in terms of your goals and being really explicit about your mission, that's really important, because sometimes people don't talk about it. They think, that, we exist in this organization, but what are we actually trying to achieve? And so being explicit about that is really important, I think.
Yeah, and
just
it allows you, yeah, I mean, it allows you to withstand arguments and allows you to withstand differences, and it allows you to withstand different opinions, because you always have that common thing to go back to. Now, if everyone can't agree, I mean, it's one thing, you have to agree on the what, the how is different. The how is where you're going to have to be, but everyone has to agree on the what. And sometimes that's not, sometimes that can be very challenging, but once you get to okay, what is the mission? What are we here to do fundamentally? Then it allows you to withstand those disagreements and everything else. Because even when it gets really, really heated and nobody agrees, okay, so all right, let's just take a second. Let's just think again. What are we trying to do here? Okay, we all agree on that. All right, let's try again, that kind of thing.
I'm just going to circle back to the chat questions. So one of them, it says that in the military practice, how do we kind of change the military to simply carry out orders into people who actively participate in tasks? So that's tricky, because the military does want people to carry out orders at any time, right? So, but we want them to also be, I guess, show initiative and be proactive. So yeah.
Right. Yeah. Well, sometimes someone will say that to me. They'll say, well, your expectations are based on military service where people had to do what you said because you had an eagle on your uniform. And I said, well, actually, we had about 2,100 employees at Walter Reed, and 20% of them were military, and another 30% of them were government civilians, and then 50% were contractors. And we were spread all over the world on 4 different continents. So most of the people were not in the military, so it wasn't a matter of just telling people, well, you have to do this. The other thing is, in the military, depending upon your branch and what mission you're doing, I don't think it is enough. There is something more than just wearing the same uniform that allows people to do very, very dangerous things, right? And put themselves in very, very dangerous circumstances. So even if it's military and military discipline, there are all of these other concepts that we have been talking about, for the last 40 minutes, that binds all of these people and that allows them to do things that normally you would not do. And I know your personnel, you take a lot of personal risk when you execute, when you execute your missions, and people are not taking that risk just because they're wearing their uniform and they have the light blue, band or helmet or whatever it is. There is something else. There is something else there. And a lot of it gets down to trust, right? Do my leaders tell me the truth? Do my leaders keep me informed? Do my leaders acknowledge when there is a mistake? And do they and are they held accountable for that? Do they hold others accountable when they don't do what they're supposed to do? Do my leaders ensure that, again, we're all bound by and we all understand what the reason is we're doing what we're doing, what our mission, what our mission is. So yeah, so the military, obviously, I mean, it's known for being very disciplined and people following orders, but they follow orders for lots of other reasons, for philosophical reasons above and beyond, well, I wear this uniform and I get a paycheck. It's a lot more than that, which is again incumbent upon leaders. And it does get to this this concept of disciplined initiative, which is I may be the colonel at HQ who approves of a plan that says you're going to do A, B, and C, but it's the lieutenant or the sergeant in that context, right, who are actually, on the field with the mission right in front of them that basically says, yeah, well, he made a decision based upon what he knew then. It is different here. So I'm going to do A, B, and D. I can't do C, right? And it's up to the leadership to ensure that those people are well trained and they understand what the mission is, and to trust them to be able to make, to have disciplined initiative.
And this is a good segue to the next question, which is, how do you influence behavior? So you have a team and you need to motivate them, and, what kind of strategies do you have to develop and influence and motivate behavioral change in your team and your staff?
Yeah. So I think this has been, I often get asked, what are some of the biggest kind of takeaways from this whole COVID pandemic thing? And I can only speak for, I can only share the perspective of my country and my opinion about how things went in my country. I think that we absolutely I think our assumptions about people's willingness to change behavior and ability to receive and process and understand information and then apply that information to their own behaviors, I think we made a ton of huge overestimates of that and made lots and lots of mistakes. And we did not pivot messages, or we did not pivot our style of trying to influence behavior to keep up with, when we found out that an assumption was not correct or not true. So I think, and I think one of the biggest issues with that, and this gets to the heart of the question, is I think you have to understand what is that person's perspective in the context of what we're talking about, and how is that going to influence whether they will change their behavior or not. So for example, you need to wear a mask and you need to physically distance. Okay, well, the 65 and over population maybe, or the population with medical problems, they would say, well, that makes total sense to me because everyone dying of COVID is like me. And so I'm going to physically distance and I'm going to wear a mask. Whereas you go to the college campuses, at least in my country, we had huge outbreaks on college campuses because those kids looked at themselves and said, well, I'm young, I'm healthy, even if I get infected, I'm going to do fine, right? What they weren't connecting was you're young and healthy, who can transmit to someone who is vulnerable. And so we really did not get into kind of the psyche of how people perceive their own risk or how people perceive their ability to contribute to someone else's risk. So that's a COVID example, but it's just in general, to influence behavior, I think you really need to understand that person's context and their perspective of how they relate to that thing. And you have to tap into that, and you have to find where there is entry points for information that they will appreciate and that they will apply to their own situation. Say, oh yeah, I've got a grandmother. I wouldn't want some teenager not wearing a mask standing next to my grandmother because I love my grandmother. So I understand this message now. And now I'm going to wear, a mask. So that to me has been one of the biggest lessons about how to influence behavior, is to kind of understand the context of the person whose behavior you're trying to influence, and to understand their perspective. And if you don't understand it, ask about it. Ask about it, right? So
Great, thank you so much. Do we have any last questions or thoughts? But if not, I just really wanted to say that, we created this series as well as part of kind of an initiative that we took because we saw that, there's so many of us in working in the UN, and many times, we feel that we can't do much. We feel that, we're not empowered. Maybe our bosses are not supportive, but we all can do something within our sphere of control, our sphere of influence. So please all go out and be the leaders that you're meant to be, and take some of these nuggets of wisdom from Dr. Thomas, apply into your own life, see how you can take some of these tips and think about how you can actually maybe make some changes to how you lead your team, or just even yourself, even if you don't have a team, how you lead yourself. But I think they're very valuable. I think the UN needs more people who can step up as leaders and be good leaders and good managers of their own team. So thank you so much, Dr. Thomas, for your time. This
Thanks.
will all be recorded, and so please feel free to share with your counterparts. And we really appreciate Dr. Thomas is really busy, but we really, really appreciate your time today. Thank you so much.
Oh, thank you. I love these meetings. They're a lot of fun. So anytime.
Thank you. And
All
we
right.
have put in the chat as well, just some of the links if you want to sign up for a future series. We try to have this once a month, and we'll try to bring more other great leadership topics to all of you. So thank you so much and have a good day, everybody. Take care.
Bye-bye.
All right. Bye.
Bye, and thank you.
Thank you. Bye-bye.
Bye, and thank you.
Thank you very
Bye.
much. Thank you for the initiative.
Bye.
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 Thank you so much.
Bye. Thank you.